Enhanced PPE donning and doffing sequence. PPE should be done using the buddy system. The buddy will read from the checklist, ensuring that each step is followed, and they will check off each item as you proceed. Wait for full instructions of each step before proceeding. Step 1 and Step 2. Check vitals and complete the contact log. Step 3. Get disposable scrubs and go to the designated room to change. Use the washroom and hydrate with water. Remove all jewelry. Check that the powered air purified respirator unit has a piece of masking tape indicating ready for use. Attach the hose to the PAPR unit and turn it on to test airflow. The testing bullet should float so that both lines are visible. Then turn the unit off. Step 4. Boot covers. Sit on a stool and tuck your pant legs into your socks or secure with tape, and then put on the boot covers. Step 5. While still sitting on the stool, pull the coveralls on over your legs. Stand up and zip the coveralls up to your waist. Step 6. Cooling vest. Insert pre-cooled cooling packs into the cooling vest. Put the vest on and adjust to fit. Pull your coveralls completely on and zip up to just below your neck. Step 7. Gloves. Put on the first pair of extended cuff nitrile gloves and pull the arms of the coveralls over the glove cuffs. Your buddy will rip off pieces of wide masking tape and create a tab at one end. Stick the pieces of tape on the edge of the PPE cart in preparation for use. Your buddy will tape wrists with wide masking tape, ensuring half the tape is stuck to the cuff of the coverall and the other half to the glove. Press all tape interfaces to ensure they're sealed, and don't wrap too tight around wrists. If there are any rips or not enough tape to wrap, begin again with new tape. Do not try to add or reuse tape. Step 8. Put the PAPR unit on and tighten the waist strap snugly. Keep the unit on your hip for easy access during donning. Turn the PAPR on. Step 9. Put on a pair of safety glasses or goggles and use anti-fog wipes if needed. Step 10. Coverall hood. Your buddy will help pull the hood up to ensure all skin areas are covered and that your hair is tucked inside the hood. Your buddy will ensure the hood is zipped fully to the top and that the zipper is locked into place. Step 11. PAPR hood. Attach the air hose to the PAPR hood and put the hood on. Ensure that you pull the elastic strap down securely around your forehead and confirm you feel airflow. Step 12. Gown. Put on a fluid-resistant gown. Your buddy will fasten the gown by sticking the Velcro fastener at the neck and tying only the outer tie of the gown with a bow. Next, your buddy will apply a piece of masking tape with a tab at one end over the tie of the gown. Step 13. Inspect yourself in the mirror to ensure facial coverage. Step 14. Gloves. Put on a second pair of nitrile gloves extending over the cuff of the gown. Remember to choose one size larger than usual. Step 15. Your buddy will now check that all PPE has been applied correctly and that no skin is exposed. Step 16. Label 2 pieces of masking tape with your name, occupation, and the time that the PPE was applied. Apply tape to both the front and the back of the gown. Step 17. Your buddy will date and sign the checklist and don the contact droplet PPE using a fluid-resistant surgical gown. Your buddy will wait in the clean area outside the treatment room to assist as required. Your buddy does not enter the patient's room. Doffing PPE sequence using the buddy system. Step 1. Communicate to your buddy that you wish to exit the patient's room, and exit only when your buddy directs you to. Step 2. Exiting the patient's room. Pull a wipe out of the container and use it as a barrier in your hand to open the door to the doffing area. Drop the wipe in the biomedical waste receptacle. Step 3. Instruction. Each instruction will be read to you completely before you are allowed to proceed. This allows for close observation of each individual step to ensure contamination does not occur. Step 4. Pick up any previously doffed PPE from the floor and place it in the biomedical waste receptacle. Remove the blue pad covering the stool and place it in the biomedical waste receptacle. If there is a PAPR on the ground in the doffing room, place it into the cardboard bin and the hood hose into the biomedical waste receptacle. Step 5. Turn slowly 360 degrees so your buddy can determine any areas of contamination. Step 6. Wipe away gross contamination. Use wipes to remove gross contamination on gloves, gowns, and any other surface your buddy points out to you. Step 7. Gown. Gently pull tie with masking tape tab at the waist to untie the gown. While facing the waste receptacle, cross your arms and grab both shoulders of the gown and pull gently to the sides to release the Velcro closure at the back. Pull the gown down and remove it by rolling it down your arms and turning it inside out. Remove your outer pair of gloves at the same time inside the sleeve, and be careful not to contaminate the inner gloves. Directly drop the gown with gloves into the biomedical waste receptacle. Step 8. Hand hygiene. Your buddy will dispense 2 pumps of hand sanitizer onto 1 gloved palm. Perform hand hygiene with gloves on. Step 9. PAPR and hood. Twist the PAPR unit around on your hip to access the air hose connection. Disconnect the air hose and turn the PAPR off. Remove the unit and place it in the cardboard bin. Reaching between the 2 layers of the PAPR shroud, lift the hood up and off to the back. Place both hood and hose in the biomedical waste receptacle. Step 10. Hand hygiene. Your buddy will dispense 2 pumps of hand sanitizer onto 1 gloved palm. Perform hand hygiene with gloves on. Step 11. Tape. Remove the tape at your wrists by gently pulling on the tab and discard into the biomedical waste receptacle. Step 12. Hand hygiene. Your buddy will dispense 2 pumps of hand sanitizer onto 1 gloved palm. Perform hand hygiene with gloves on. Step 13. Zipper of coverall. Using a mirror to guide you, undo the zipper of the coverall completely and be careful not to touch any other area but the zipper. Step 14. Hood of coveralls. Gently pull off your hood by pinching each side near the temples and slowly roll it off the back of your head. Step 15. Hand hygiene. Your buddy will dispense 2 pumps of hand sanitizer onto 1 gloved palm. Perform hand hygiene with gloves on. Step 16. Stool cover. Your buddy will provide you with a new blue pad for you to drape over the stool. Step 17. Remove coveralls. Insert clean gloved hand into the opposite cuff of the coverall and pull the sleeve over the glove. Repeat with the other hand in mitt fashion. Slide the coverall below your knees while rolling inside out, touching only the inner surface of the coverall. Sit on the stool near the exit line. Remove coverall leg and boot cover. Place your foot on the inner surface of the coverall and repeat with the other leg. Stand up with your feet still on the inner surface of the coverall. Step 18. Hand hygiene. Your buddy will dispense 2 pumps of hand sanitizer onto 1 gloved palm. Perform hand hygiene with gloves on. Step 19. Remove the cooling vest. Undo the straps at the waist and 1 shoulder. Then slide the vest off your remaining shoulder into your hand and discard into the biomedical waste receptacle. Step 20. Removing inner gloves. Using the glove-to-glove, skin-to-skin, remove your gloves and discard in the biomedical waste receptacle. Step 21. Hand hygiene. Your buddy will dispense 2 to 3 pumps of hand sanitizer into your palm. Perform hand hygiene. Step 22. Eye protection. Remove your safety glasses or goggles and discard them into the biomedical waste receptacle. Step 23. Hand hygiene. Your buddy will dispense 2 to 3 pumps of hand sanitizer into your palm. Perform hand hygiene. Step 24. Remove the bouffant cap and discard into the biomedical waste receptacle. Step 25. Hand hygiene. Your buddy will dispense 2 to 3 pumps of hand sanitizer into your palm. Perform hand hygiene. Step 26. Exiting the doffing area. Step off the inner part of the coverall, across the exit line, into the clean area of the floor. Step 27. Hand hygiene. Go to the designated sink and perform hand hygiene for 1 minute with soap and water. Wash up to your elbows. Step 28 and Step 29. Obtain post-vital signs, complete the contact log, and your buddy will sign and date the checklist.